Hi, I'm Dr. Kelly Fraden. I'm a pediatrician and a mom based out of New York City, and author of a new book, Parenting in a Pandemic: How to Help Your Family Through COVID-19. I've been on Instagram for a while and talking with thousands of families about how they're dealing with coronavirus. Parents are making 4 mistakes in their thinking, and I'd like to tell you about them so you can avoid making the same mistakes. The first is to think about your family's precautions as all or nothing. The truth is that once you have gone from being locked down to being out in the community more, it's easy to think, well, I'm doing this, so I might as well do everything. But that's not the truth. Imagine if we took someone sick with coronavirus and put them in a small room with you. You know that the longer you spend in that room, the higher your chance of catching coronavirus. It's no different regarding the choices that you're making in your community. If you wear your mask most of the time, you will decrease your risk. So remember, it's not all or nothing, there's a lot of gray in between. The next thinking trap is to assume that virtual education is safer. Schools have taken a lot of steps towards making safe space for learning this fall. They're doing wellness checks, they're sanitizing, they're masking. They're doing all these things that they think will help decrease transmission, and I think they should work. What I do know is that the precautions you take outside of school, you also take responsibility for. So just because a pod of children are meeting at your house, there's nothing intrinsically less risky about your friends than your schoolmates. So you need to remember that the precautions that they're taking in school may be useful for you to take at home as well. The risk of your virtual learning environment will depend totally on how you make your decisions for what you're doing. If your family sees a lot of close contacts without masks or distancing, you may be at higher risk than if you were to attend conventional school. It's really up to you. The next thinking trap parents enter into is to assume that there's no difference between your child's close contacts and your close contacts. My daughter's going to be going back to daycare soon, and when I'm doing drop-offs and pickups, I shouldn't assume that there's no need to distance from the other parents in the school because my daughter's been exposed to their daughter. We know that the most likely way to catch coronavirus is in your direct contact with other people. So while it's true that their daughter might pass coronavirus to my daughter, it's in school, I'm protected from that risk because there's only a 5 to 20% chance that if my baby girl gets sick, she'll give it to me. So if I have a close contact with their parent, I'm skipping all those moments when the transmission of the virus may stop. So I shouldn't just put my guard down because our kids are in the same class. The last thinking trap is that we have to protect our children more than ourselves. The data is clear that parents are at higher risk for complications from coronavirus than their children, unless, of course, the children have chronic medical issues or are a newborn baby. It's important for parents to remember that your kids need you to stay healthy and prioritize taking care of your own health during this time. I hope this information will help you make the right decisions for your family this fall.